Okay, so good evening. So today I thought that we should discuss some of the complications of poorly controlled hypertension. So hypertension is a very common disease in the community and it's the commonest cause of heart failure. So usually most people they move around with blood pressure that is very high without knowing because we don't have that routine of having our blood pressure checked like every maybe every 1 week, every once in a month. So you find that most people will be moving with these high levels of hypertension without knowing. Now, hypertension has got some certain um, certain complications, and the target organs that hypertension, which is not controlled, will target. One is the left side of the heart. So usually what happens with someone has uncontrolled hypertension, the left side of the heart tends to thicken, the heart muscle tends to thicken. And when the heart muscle thickens, even the function is compromised. So that is the first target organ for poorly controlled hypertension. Now, hypertension can also affect the eyes. So you find that most people with this poorly controlled blood pressure, over time, they tend to have poor vision. Also, the poorly controlled hypertension can cause kidney problems. We are seeing quite a number of people now having what we call renal failure or kidney dysfunction because of poorly controlled or unknown hypertension. So it's very important to control our blood pressure and how it's checked. And also the most important thing is to adhere to medications. So medications they tend to control our blood pressure and they reduce the risk of complications. So that is actually what happens when someone has had this hypertension which is poorly controlled. So it's very important. It's also important to adhere to lifestyle changes. So we reduce our weight, we manage our weight, and also avoid things that can cause problems with the heart, like chronic alcoholism, obesity, and also stress. Because we know that we should also take in mind that most of the causes of hypertension are not known. So that's what we call essential hypertension. So we only have 25% of the causes that we know, which I've mentioned. Maybe we have a problem with the blood supply to the kidneys. Maybe there's a narrowing or stenosis. Also, maybe there's a narrowing of the aorta, the big vessel that comes from the heart going to the rest of the body. So those are one of the notable, and also endocrine disorders. So those are some of the causes. But the main thing here, briefly, just to mention about hypertension, summarize about hypertension. We need to have good control. We need to have adherence to medication, and also we should have so much concentration on lifestyle changes. So we manage our weight. So this can avoid having complications which I've mentioned. Okay, so for today, that's all we can discuss on our page. So we keep on discussing many topics as we go on. Thank you for listening.